Hi everybody, my name's Didi Verg, and today I'm speaking with my two special guests, the Patient Whisperers. This is Roger Woods and Marc Sacco.
Hello.
So welcome to the program.
Thank you for having us.
And they've both been nurses for a number of years. How long have you been practicing?
About 22 years.
Okay, and you?
And about 23 if you include the paramedic.
Right, okay. And when did you introduce what we're going to call verbal medicine into your practice in the emergency room?
So, a relatively short time ago. It's about 4 years, 4.5 years, that Roger got me interested, and we went and got trained and realized that we were actually doing this as nurses naturally. And it just dawned on us that this is a natural fit. Nursing and hypnosis is a natural fit.
Okay, and by the way, they're both registered hypnotists, so they call it verbal medicine, but there's elements of hypnosis that they're utilizing while in the emergency room, and they will be sharing with us the effects of that. So.
Yeah.
Sure.
So go ahead. Why don't you explain a little bit about what verbal medicine is, Roger?
So verbal medicine is just using the technique, some techniques of hypnosis, but enhancing the care that we do at the bedside. Nurses are natural hypnotists. They are doing this daily. They just don't know what they're doing. Because we have learned this, some modalities, it enhances the patient care at the bedside. Not only that, Didi, but it also gives us energy back, right? Because nurses give out a lot of energy. We take on all of this angst, all of this trauma, and what do you do with it? Well, we've learned now how to package that up, make some use of it, and so when we're giving out energy, which nurses do every single day, we're actually receiving some energy. So instead of just giving all at work, we can save some of that and give some more back at home, because nurses have a habit of giving, and not getting anything back. And we're stealing from the home.
Right.
So we've learned how to enhance our interaction with our patients.
And just for the nurses listening, because we do understand that there is a very high burnout rate when it comes to nurses because of exactly what you're speaking about.
So that's reason number one why we both went into it. We had 1 foot in, 1 foot out. We were burnt out, right? You take on all of this angst, and what do you do with it? You know, we're overworked, we're rushed, we just can't give the care that we want to give. When we all came into nursing, we all wanted to give the care that we were taught to give. We're not allowed to give it anymore, because now it's all tasks, and we have to do this procedure, we have to do that, rush. We're not at the bedside, and the intent isn't there anymore, right? The intent to do good, to nurture, we're not able to do that. Because,
especially in the setting like the emergency room.
well, in the emergency room, we don't have any time. We don't have any time to do that. So what little precious time that we have, we actually monopolize, and we actually do what we need to do. Because the moment to change somebody is at a time and point when you can. They've opened themselves up. They come in a panic mode, right? They're out of control. We give them a little bit of control. And once you give them some control in this calamity, they can see that they can use this little piece here in the rest of their life.
So give us an example of that. Like, how would you impact somebody in the emergency room and then give them the gift of something they can use their entire life? Do you have a case story?
We have, every single day, we have to do IVs, right? We have to draw labs and do an IV. That is a very pivotal time in someone's life. A lot of people come in needle phobic. Marc has a wonderful story about, well, we have all wonderful stories about kids. You know, at one time we used to have to dress up. There used to be 4 or 5 of us go into a room and then tackle this kid to get an IV.
And pin them down.
Hold them down.
And there's crying.
Traumatic.
And that's just the nurses,
and yelling.
right? Yeah. And so we don't do that anymore now. We don't have to do it.
Seems a little barbaric.
It is barbaric.
But they still do it in other hospitals. You just don't do it anymore.
Correct.
We don't have to do it.
Right.
We don't have to do it.
So tell us a little bit about that. So how would you, because I know, I mean, even in my hypnosis clinic, we have people come in for they're deathly afraid. And you have a story, do you not, where...
I have many stories, but one of them, an interesting one I had recently, was a 6-year-old girl who had cut her eyebrow. And the mother pulled us aside and said, she's very needle phobic. I don't know how this is going to happen. I don't know what to do. And we said, don't worry about it. I'll take care of it. So got a little rapport with her, and I started talking to her and finding out where her favorite place was. And it happened to be Grandma's house. And I went, that's awesome. That's great. I want you to pretend that you're at Grandma's house right in the front. What does it look like? What do you see? And she said, there's a door there. And I said, open it up. Well, what do you see? And she said, I see this big flowery dress. It's Grandma. And I went, that's great. Where's the favorite room in this house that you would go with Grandma? And she went, the basement. I went, ooh. But we'll go with it.
For her.
We'll go with it, and we'll see where this leads. And she went down to the basement. That's where
Which is great for hypnosis.
Absolutely.
We bring them down.
Right, yeah.
And she gets down in the basement, and that's her playroom. She had building blocks there. I said, that's great, wonderful. You have a pile of building blocks. What do you want to build? She said, I want to build a castle. Great. The key to it, the kids are, make the details happen.
Okay.
So when they start thinking about the details, they go deep, way deep.
Okay.
And that's when you have them. So I asked her, okay, I want you to build the castle. Pretend like you're building the castle. Pick up the first brick, block. What does it look like? What color is it? And that's when she started thinking. She said, red. Boom, I've got her. Now she starts building the castle. Now the cool thing is she's 6 years old. I get her to build a castle in Grandma's basement. And then I say, okay, well, what's inside that castle you just built? And she says, oh, well, there's a kitchen. Great. Is there a playroom? Yes, there's a playroom. Great. What's going on in the playroom? Oh, I want to build a castle in there. So she built a castle inside of a castle inside of the basement of Grandma's house, which is inside her mind.
Wow.
Blew me away. Now, the whole time, the PA goes over, sticks her with a needle right above the eye, which is so traumatic. She didn't even flinch. She didn't even know. She's giggling. Yeah. She's having a wonderful time. He does it. He puts six stitches in her eyebrow. The whole time she's just laying there talking to me.
Yeah.
She gets done. She's laughing. She's giggling. She had a wonderful time. And that's the important part. I can install now post-hypnotic suggestions. And so I can set her up for life.
So she came in previously completely needle phobic. Now she's gotten a needle and stitches, didn't even realize it, and then you set her up how?
Yeah, I said, hey, did you know that anytime you go to a doctor's office, a dentist, a hospital, any kind of medical place that you have to go see a doctor, you can do this again. All you have to do is imagine that you're Grandma's basement and that you're building a castle, and you can build another castle. And you can do that anytime you want. Isn't that great? Right?
Right. And she was good.
And she loved it.
She was good. And her mother, I'm sure, was.
Oh,
what
she
was
was
the response
ecstatic.
from her mother?
Ecstatic. Absolutely ecstatic.
So we've turned two people around by just using language.
Right.
And that's what we do. We just use beautiful language. Language that heals. Because there's two types of language, right? There's language that hinders and language that heals. A lot of nurses use a lot of language. Not just nurses, but the whole care team. Use language that hurts, such as when you say, okay, I'm just going to poke you. They don't hear poke, they hear poke.
Right.
I'm just going to stick you. They don't hear stick, they hear stick. And everything's
amplified, isn't it?
Amplified, and there's an emotional response to words. We just use healing words.
Right. Right. So what other case studies can you share with us? Because, I mean, in the ER, you must see some pretty...
Thousands.
Amazing. Well, 18,000,
We've seen 18,000 patients in 4.5 years.
Let me cut him off at 18,000 patients. We've also got the family members, and we've got the staff members that we interact with. Everybody that we interact with. We model great behavior. Model great behavior. And that's what it's all about.
Because the family's actually traumatized when they come in, too, if the child or somebody in the family's had a big accident.
So
everyone's in trance when they get there.
Everybody. And the families can be the major problem. I'm going to say problem because
they mean well. They're well intended, but they get all hysterical, don't they? And then that makes the patient hysterical.
They're also using that language that hurts, that hinders. So most of the time when I go into a room, I'm talking to the patient, but really my audience is the family members. And once they hear me talking to the patient, and I steady everything down, tell them everything that I'm doing, and just calm down the room, everything is wonderful. Now, I can leave that room for 2 hours, and the instant I come back in there, I've got instant rapport again.
Good.
Now, it's not as if I've left the room. They know I'm still there, but I'm not there.
Right.
But
so they feel that, they just feel they're grazing on the warmth of the whole thing.
They're cared for.
Yeah.
A lot of nurses go in, they do the tasks, and they do tasks very well, and then they leave. And they have no connection with the patient. So that patient doesn't feel like they've been in the room.
And I'm sure they feel very scared. I mean, if you're going into emergency, something pretty bad must have happened. So I can't imagine.
So we reframe that too.
Yeah.
I mean, it's not bad. Thank God you're here.
Oh, right.
We reframe them. The minute they come in, the worst is over. It's a great line. The worst is over.
Yeah.
I'm glad you're here. This is what we're going to do. So there's many cases that they'll say something that we have a little game where we have to reframe them. If it's something negative, we have to leave them with something positive. And that's what keeps the energy inside of us, because we're not only reframing them, we're reframing ourselves. That's where the energy is, and we can build
Keeping
up
it
that,
all calm.
keeping it calm and also getting energy back, right? It makes it fresh. As I said, 4 years ago, we were ready to come out of it.
Absolutely.
Now it's all fresh and the intent is back again. And that warmth, that glow when you leave each patient, that you've made a difference. We have this influence as healthcare givers. We have this expectancy of care, right? They expect us to take care of them. And we drive the care, because if we're not driving the care, if we leave it up to the patient to drive the care, they have no idea where they're going. We know where they need to go. And we can speed it up or slow it down. We know the terrain.
So in terms of the impact in the emergency room, for example, using the verbal medicine, does that cut down the need for medications or things like that?
Yeah.
So one of the nice things is verbal medicine can be used in the nursing process. We're not taking extra time out of our nursing care to do any of this hypnosis, verbal medicine, NLP. It's integrated into the stuff we do. When we take a blood pressure, it becomes an induction.
Oh, right.
When we use the stethoscope, it becomes an induction, a pacing, a matching, a mirroring.
And an agent to calm people.
Yes. Yeah.
Yes. Yeah, it's wonderful. We integrate everything that we have. We have all these tools. They're not just tools for healthcare, but they're also tools for relaxation. And we use them, we interwove them every time we have a patient. And our blood pressure induction, which we developed, is wonderful. It's wonderful. And that's a covert way. We don't actually tell them we're doing hypnosis. The minute we tell someone that we're doing hypnosis, that barrier comes up and we're not going to get anywhere.
And we don't have time.
We
don't have time for that.
Explain it.
We've got to get in there. We've got to get them there.
We want to relax them. We want to take them from this state to this state, a state of being out of control to a state of being...
And in pain, right? So how does the verbal medicine help with people who say they come in with a broken leg or something and they're in an intense amount of pain?
First thing, we don't mention pain at all.
Right.
We don't give them that suggestion. Tell me about your pain. Oh, well, it's got to be... Because he asked me that question.
Right.
We look, we read the body, the facial, the words that they're using. And so if they're not expressing pain, why ask them? Why suggest them to be in pain?
Why focus their mind on it, right?
So there's many modalities that we can use to reduce that. And another thing is when we give them medication, we can give them less medication. It'll last longer. And they'll heal faster with the words that we use.
Can you minimize bleeding with the hypnosis as well? If the person comes in bleeding?
Most definitely, yeah.
Okay.
Yeah.
So tell us a little bit about that.
Well, you just tell them, that bleeding will stop the moment that you want it to stop. It's done its job.
Really?
It's told us where there is injury. Now you can stop that bleeding right now.
And it stops.
It will stop, yeah.
That's absolutely
Let me
incredible.
just put this on. Well, you also tell, I'm just going to put this on here. It's going to control the bleeding. It's going to control the bleeding. Right. So now that's a distraction, right? So
and they think it's kind of that's the thing that's doing it, although they're doing it.
We've already suggested. Everything we do
is a positive suggestion.
Is a suggestion, yeah.
Hence the name verbal medicine.
Right.
Okay, so what other case studies can you share with us? Something really miraculous that's like...
well, there's thousands. There really is thousands. But I'm going to have Marc tell you a story. Not a story, but one.
Put me on the spot.
I'm going to do the kid with the bacon.
The bacon. All right.
Well, this should be interesting.
Yes.
Bacon, emergency room, and...
A fractured femur.
Fractured femur.
So femur is the big bone in the leg, the top part, upper
thigh.
part of the leg. This young boy, he's 9 years old. He was out walking his dog, and the dog got the leash wrapped around his leg and saw something and bolted, and it snapped his leg.
Oh.
Yeah. So they brought him to us.
Yeah.
Now we're a level 2 trauma center, and there's the next step up is level 1, and they take pediatric traumas and they can do surgery. So we know we have this child. We need to get him prepped and ready to go because he's got to be transported to the next hospital. He's got issues because he can't take many of the pain medicines that we would use. We've got an ambulance on the way. The OR is already waiting at Yale. So we've got to get him ready, and we have to put a splint on this leg.
Okay.
We need to start an IV. We need to draw blood. We can't give him any pain medicine. We got an ambulance on the way.
Was he allergic, or?
He was allergic to most of the narcotic pain medicine.
And this is, from what I understand, very painful.
Yeah, when your femur is going like this,
ooh,
it's pretty bad. So we needed to stabilize that for the trip.
Okay.
So we were able to go in, and actually we double teamed him that day, and he did breathing, and I did some anchoring.
Okay.
While I was
so
looking
explain
for
what anchoring is to the
so
audience.
while I was looking for an IV, I was tapping, and normally we tap like this to get the vein to pop up.
Right.
In this instance, I knew where I was going to go,
Okay.
so I started talking to him, and I started tapping rhythmically.
It's like hypnotically.
Hypnotically tapping and telling, and he
Right.
was doing the breathing.
Okay.
And doing the healing breaths in through the nose, hold it for 3, out for 6, and relaxing him that way. So once we did that, we need to get him into a story. We need to know his favorite thing. We need to know what really jazzes him up. He had nothing.
Nothing. Okay.
He had nothing. And
I
finally,
like to think children have an imagination, but this
we
one
could not get
is going to be
any
an
favorite.
accountant or
I don't know.
mathematician?
No
just
favorite
needed it
movie.
all.
No favorite this. No, we just couldn't get anything. And Mom pops up from the side there and says, "Oh well, he loves bacon." And I thought,
Okay, there's your challenge.
there's a challenge, because I don't know what I'm going to do with bacon. I can fry it and I can eat it, but what am I going to do with it? So I started thinking and thinking, and finally said, well, okay, let's make a bacon world. Let's make your world out of bacon.
Okay.
And so I
I'm sure there's an interesting ending to this story.
I put him in front of his house. You know, we tap, 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 brought him back down, and put him in front of his house, and I asked him, what is the sidewalk? You know, what does it look like? What is it made of? And he just looked at me flatly and went, bacon. And I'm like, oh, this is not going to go well. And I have no time. The ambulance is coming. The OR is waiting for this. So I started talking. Well, now tell me, is the bacon going sideways or is it going long ways? And he goes, oh, well, it's going sideways. Great. Okay, build that thing all the way to the door. Great. Now I want you to walk up to the door. And as he's walking, I ask him, well, hey, is it crunchy or is it kind of squishy? He says, oh, it's crunchy. Great. Can you hear that crunch as you walk up there? And he's like, yeah,
and all of
this
this
is
very
cool.
hypnotic language, by the way. When you get someone feeling, seeing, and hearing something, they go right into a trance.
Yeah.
So you really
Those
had him
details, I had him.
experiencing bacon.
Yes. So we
Okay.
get to the door. I ask him what the door is. And again, he says, bacon. And I said, no, tell me what it's made of. How is it configured? Is it up and down? So he gave me the directions. Oh, it's up and down. There's a window. And I said, that's great. Now, what's the doorknob look like? Is it round or is it kind of fancy? And that's when I got him for the details.
Okay.
Because he started thinking, really, oh, wait a minute, it's curved and it's got these little things. He started getting real technical. I said, I got him.
Okay.
Boom, I went and put the IV
IV
in,
in.
drew the blood. He didn't flinch. He didn't stop his story. He kept talking. He opened the door. He was walking in.
So he didn't know that you put the IV
He had
in.
no idea.
Yeah.
He didn't care.
Did not
Didn't care. Yeah, he was in his bacon world.
Yep.
Bacon world.
Bacon world. So I was done.
Okay.
And we didn't want to get him too far down the story because we still have to pick up this leg and put a splint under and put it back down.
Which would normally
Which
be
is-
incredibly painful, even
Yes.
with pain medication.
Well, normally we have to sedate them. We have to do a conscious sedation.
Okay.
And that takes time, and we just didn't have time.
And he was allergic too.
And he was
to it.
allergic to
Okay.
everything.
So continue with bacon.
So we brought him
world.
back out. We got the doctor and we got him ready. And we got the splint and 2 people and myself. And the lights are down low. The family's still sitting there. And we go in. And we told the doctor, you can't say a word.
Right.
Just shut up and walk in. And he was good with that.
Okay.
Because he knew what we were doing. And we walked in and we got ready. I tap, tap, tap. Brought him back
into the
down.
trance.
He was back into the living room. He had a bacon couch and a bacon TV. And I said, great, what's on TV? He said, a bacon football game. Awesome, great. I get him to start describing the play-by-play with this bacon field and the bacon team and everything. As I'm doing that, they are in there and 2 people are lifting this jelly leg up and 1 person is sliding it under, and they set it back down and they strap it up. The whole time he is talking, he briefly interrupts himself. And it was something like this. And the bacon running back was walking, and then he made a turn, and it was like
That was it.
just that little hiccup
That
was
was it.
all he stopped, and that was it.
And so he didn't even realize that he had been splinted, IV'd.
Nothing.
And what's the most important thing about that story? The mother.
The mother. Unbeknownst to us, the mother is a psychologist.
Oh.
And she came up out of the room and came to us and said, I have to tell you, I'm a psychologist. I've never seen something so incredible. That is amazing. And I have to tell you, I have to go apologize to one of my coworkers. For months, he's been trying to get me to go to a hypnosis chapter meeting, and I've been laughing at him, and we've been making fun of him. I'll never do that again. And that was
And what's most
amazing.
incredible is the length of time that Marc told that story is about the same amount of time, less than 10 minutes it took us to do that.
Right.
It would have taken a lot longer for the doctor just to put in the medication order.
Oh, really?
And for us to get the medications to start the conscious sedation. So it's quick, it's effective, it works.
Well, the conscious sedation would have taken an hour and a half to 2 hours.
So he would have had
He
to
couldn't have
sit.
gone. Yeah, he would have had to stay there. He couldn't have had taken the ambulance ride. The OR would have had to wait, and he would have not gotten the help he needed for longer.
So let me ask you this: what do the doctors think of you?
Oh,
where
they
you
love
work?
it. They love us.
It. Yeah.
They love it.
We've proven ourselves.
Okay.
They've seen it work on their
Well,
patients.
obviously, if that you had to, you could have avoided all of that and got this done in 15 minutes, something that would normally take 2 hours.
Everybody loves it. Family, staff members, doctors, and we love it too.
Yeah.
Right, because you're no longer burnt out, are you?
No, this is our playground now. We love to go to work and challenge ourselves. As what's the
When
next
someone throws-
difficult patient?
When someone
Bring
throws
it on.
bacon at you, I mean, that's pretty
If you can handle bacon, you can handle anything.
Yeah, after that, you're like, I got it. So what would you say to nurses? Because nurses really, I mean, we know they want to help. Maybe they just don't have the tools. So what would you say?
So to nurses, I say, remember Florence Nightingale. She stated, change the environment, change the outcome. Now, most of us think that means cleaning the floors and making it pretty and that kind of thing, but she was also talking about the mind. She was saying, get their mind in the right state and it's going to help them recover. So that's what we've gotten back to, is the original purpose of nursing. And it's the art of nursing, which has been missing for so long.
Right,
We
and it's
bring that
not
back.
because they weren't well intentioned. It's just
Absolutely.
Just our training in medical
Our training is task-oriented.
Yeah, it's to get it done.
We learn the science of nursing in school. No one gets taught the art of nursing. And you get taught that by the elder nurses that you work with, the mature nurses, the seasoned nurses, who are leaving the industry because they can't handle the pressure, all the tasks, all of the inefficiencies, and they're getting burnt out. And so our goal is to rejuvenate nurses, making sure that they do get that energy back, right? That gift.
And at the same time, improving care for the patient and
Absolutely.
the family.
Absolutely.
It's a win-win. Everybody wins. Everybody. The patient, the staff, and the nurses.
So if you could leave the audience, each of you, with one thing you believe is important for them to know, but just because of everything you've seen, how important this is and the environment.
Well, for my nurses, I want to let them know that we've developed a nursing credential for nurse hypnotists.
Okay.
CRNH, Certified Registered Nurse Hypnotist.
Okay.
And that is going to be that crucial training that you can get to do what we do with verbal medicine.
Okay, so that's good. So every nurse out there, if you're interested,
please
contact.
come see us.
It's not too late to love nursing again. It really isn't. We've proved that, that we can reinvent ourselves to get back that energy. The reason why we got into nursing, all of that education, all of that horrible education that we had to go through, because every week in nursing school there's a test that could make or break your next progression. So we put a lot of energy into becoming a nurse. I want to put a lot of energy into keeping you a nurse too.
Excellent. So again, if you could leave our audience with one thing about the power, just how incredible this is when you utilize this through all the things you've seen in your career, what would you say?
The one sentence that turned me when I first started learning hypnosis was, the brain, would you agree, and this is how I say it, would you agree that the brain controls every cell in your body, right down to the chemical releases?
Yeah, because our thoughts create our biochemistry, do they not?
So why not use that to your advantage?
Sure.
And that line, that whole line, totally sold it for me. It went from being any kind of woo-woo mystical thing to a holy moly, that's my brain doing it.
Yeah.
So I can do this.
Well, your brain creates things like anxiety, so it makes sense that we all have our own endogenous hormones for morphine and things like that to heal ourselves. The placebo effect shows us that.
Oh, it's fabulous.
So what would you say,
Roger? Pardon my language, but I say this all the time. I'm a meat eater. I'm not a tree hugger. but this shit works.
That's just it. This shit works.
Yeah.
It does. It works.
Mm-hmm.
It really does. Mm-hmm. And I love every minute of it.
Yeah.
Well,
and
we can definitely see that the passion is come back full force with the both of you.
Yeah.
So thank you
It
for
is.
the job.
Well, thank you.
All right.
Thank you.
Thanks for having us.